This is Women's Health Weekly from the experts in women's health at Maiden Lane Medical, bringing you expert health information from our team here in New York City. So we've talked about a whole lot of different contraceptive options, but we left out two. Right? So we left out...
We left out a couple.
Well, you mentioned... we did, right? Two major categories. We left out barrier methods. And is this as straightforward a conversation as I think it is?
Yeah, I mean, so we've left out barrier methods. We actually left out, as far as hormonal, we actually forgot about the shot too.
Did we? That's right. We didn't talk about Depo-Provera.
Yeah. So that is another form of contraception, just so that everybody out there has all their information. It's given in the office, so it's a progesterone hormonal contraceptive that's given in the office once every 3 months. So you have to come see us every 3 months, and it's a shot. And it's a shot usually in your arm or in your buttocks region into the muscle. And it's a great form of contraception in the sense that just like the arm implant and the IUDs, it's over 99% effective. A lot of women lose their periods on this one, so you do have to be okay with that. And you have to come see us every 3 months, which we certainly don't mind, but it depends how, if you can get into the office every 3 months. But it's not something you have to take every day, and it can be really beneficial for a lot of women that, again, their lifestyle just doesn't allow them pills, patches, rings, things like that. So just to touch on that, so we truly have covered all hormonal contraception.
Isn't there some data on use of Depo-Provera in very young women and bone loss, or potentially not being able to achieve your maximum peak bone mineral density in your early 30s?
So years ago, we actually would, even when I was training back in residency, we would only keep women on Depo-Provera for a very short period of time because of the effects on bone loss. But actually, research then showed that in otherwise, young, healthy women, actually that bone mass reaccumulates after stopping the Depo-Provera over time. And so we no longer get as concerned about your bone density and the lower bone mass due to Depo-Provera. So we do feel more comfortable keeping patients on it for a long period of time, and even teenagers.
Is the conversation about barrier methods as straightforward as I believe it to be?
Barrier methods in general include there's the male barrier methods and female barrier methods, and condoms is male. And females, we usually think of, although there is a female condom, but we usually think of diaphragms. But diaphragms are actually really hard to come by these days, and they're really difficult to use properly. And so I don't even know the last time I've had a patient actually come in saying that she either A, wants a diaphragm, or B, is still using a diaphragm. They're actually really hard to find. And in general, they've kind of gone by the wayside a little bit. They're just really hard to use. And then there's condoms. And I definitely still have a lot of patients that, solely use condoms. And I think our job is just for them to know that, it's certainly not the most highly effective form for prevention of pregnancy. But, another point is, of course, all these forms of contraception, they're not protecting you against sexually transmitted infections. And so, condoms should be used in addition, especially if you're not, in a monogamous sexual relationship. But yeah, it's pretty straightforward as barrier methods. And then there's also permanent sterilization, which I don't know if we're touching on that, but that's the other form of contraception.
We can. We'll go back to barrier methods because we're in New York.
Sure.
And because we're in New York, and because I am, some might say, an older guy, I spent a tremendous amount of time in my 20s, I guess it was my 20s, watching Seinfeld. And I want to know if anyone out there is still Spongeworthy.
Do you think you're Spongeworthy?
Yes, I think I'm Spongeworthy. I think I'm very Spongeworthy.
The question for you, doctor, does anyone still use the sponge?
No. No, they really don't.
All right. Okay, so one thing that we didn't touch on, abstinence.
Abstinence, withdrawal methods, and timing methods. So abstinence, you're absent of intercourse, right? Withdrawal methods, where the male will withdraw the penis from the vagina before he ejaculates. And then the timing, or what a lot of women call the rhythm method, where you're trying to be abstinent, not having intercourse, around your most fertile days. Of course, abstinence is going to be highly effective in prevention of
100%.
pregnancy.
100%.
100%. 100%. You're good. The other two are, there's a ton of user error with both withdrawal method, as of course, I'm sure you can all realize why, and the timing method, just because cycle, a lot of women, first of all, don't understand it and count wrong. But even if you're counting correctly, there's still a ton of user error with rhythm method, because our cycles aren't always exact. Even if you think they're exact, it may not be exact this month, and you can't necessarily predict that. You ovulate, you release that egg before you get your period, and so you can't always predict that it's going to be exactly 28 days. Maybe it will be 30 days this cycle. Maybe it'll be 24 days this cycle. And so your fertile window changes based on that cycle interval. So there's just a ton of user error, and which is why they're not highly effective at all.
So this has been Women's Health Weekly. Thank you very much, everyone, for your fantastic questions.
Yeah.
We really appreciate them. We really appreciate your feedback. We really appreciate Dr. Nikole Ostrov from Maiden Lane Medical, and you can reach us at maidenlanemedical.com. And I hope everyone has a really fantastic Memorial Day weekend. Stay safe and healthy, and enjoy.